My name is Susie Boros. I'm the nurse practitioner for Cardiology Associates here at Armstrong. I work with Doctors Khalil, Tabara, Redican, and Ranganathan, also known as Dr. Karthik. All of them and all of us deal with congestive heart failure on a daily basis with multiple patients. There are two ways that people have congestive heart failure. First, they have too high of blood pressure, or they have a very weak muscle. Those are the two things that most frequently cause congestive heart failure. We manage it with medications, with diet, and with patients' involvement in their own care. It's very important that you stay attentive to what you need for yourself. We're going to discuss congestive heart failure, and I wanted you to be aware of the signs and symptoms of congestive heart failure. Most people will show up to an emergency department when they are severely short of breath, their ankles or legs are severely swollen, and for some people clear to their waist. Their heart is racing in a way that is very scary to them, and they're struggling very much to breathe and coughing a lot. A lot of people think that they have pneumonia because they are so short of breath, but most of the patients who have had congestive heart failure will recognize that this shortness of breath is from an increase in the water weight that they have. The one thing that we encourage patients to do is weigh themselves every day, and should they have a 3-pound weight gain overnight or gain 5 pounds steadily in a week, the cardiology service needs to know. We have way too many patients who show up at the emergency department 30 pounds heavier than the last time that they were seen. That is not normal for any patient to gain that much weight in a short period of time. We prefer that you call within that 5-pound weight gain, and we can make adjustments to your medications while you are at home without bringing you into the office. A lot of people object to going to see the physicians a lot, so we make sure that we have a nurse practitioner or PA available in the office from 8 o'clock in the morning to 4:30 every day to take care of any patient calls, especially with weight gain or shortness of breath. If you call in an early fashion, we can adjust your medications and keep you at home. We can do blood work as an outpatient and make sure that you are doing just fine. Again, the symptoms would be shortness of breath, cough, weight gain, and swelling, which is why we want everyone to weigh themselves daily, take their blood pressures, and record those so that we have an idea of what their trend is. One of the things that is most important for our patients to know is that we are available to help them at any time through the week. If you have issues overnight or over a weekend, you need to know that an emergency department is available to you at all times, and do not hesitate to go there, especially if you have rapid onset of very bad shortness of breath. You should present to an emergency department. If you can't lay down to sleep at night, you need to make sure that you are seen by a physician as soon as possible. Calling 911 and coming in is very important at that point to get help. If you have swelling, that you're having any kind of water leakage from your legs, you need to be seen in an emergency department. That is not something that should wait to see a doctor. You should go if you are feeling dizzy, lightheaded, or very faint. It is very important to call 911 and be seen in the emergency department as soon as possible. If you're experiencing an increase in your cough, especially over the nighttime hours, if you awaken from sleep with chest pain or shortness of breath that you cannot catch your breath, do not wait until the next day to be seen. You need to be seen in an emergency department. You should always be in touch with your primary care physician so that he knows what your medications are, what your symptoms are, and how we are treating you. We work very well with every primary care service in Armstrong County. They have our phone numbers. They will call at any time, and we work very well together with anyone who is associated with Armstrong County Memorial Hospital. We are happy to help in any way with the primary care physicians, and they will be the ones to manage your other health issues, such as diabetes. The cardiology service does not manage diabetes for them. So we will work with them in any way possible to try to keep you at home and healthy as long as possible. The first thing that we do when we bring people in is we do a weight, a blood pressure, and a pulse. Everyone who has congestive heart failure needs to have a scale and a blood pressure cuff. It is absolutely necessary that every patient with congestive heart failure weigh themselves one time a day, every single day, and take a blood pressure one time a day when they've been resting for 15 minutes, so that we have a good idea of what is going on with them. We ask all of our patients to take their medications on a daily basis, the way that they are prescribed. The most important thing with the medications is that they be taken in a manner that is consistent. Most of our medications will be prescribed twice a day, and you have to take them twice a day. We don't encourage you to use more than one physician to manage your congestive heart failure. The cardiologists are the ones who are the primary prescribers for congestive heart failure, and we are always available to help you manage yourself at home. Our goal in congestive heart failure is to make sure that everyone stays at home. You will need to be taking a water pill or a diuretic. That can be Lasix, that can be Bumex. Those will be the two primary ones that you hear. You will be taking blood pressure medications. One of them that's used a lot is lisinopril. The other one that's used a lot is valsartan. And the third one that is new and used very frequently now is Entresto. The other medication that you will be using is called a beta blocker. It will be metoprolol or carvedilol primarily. Those medications, each and every one of them, is taken once to twice a day routinely for everyone who has congestive heart failure. The management for you at home will be with your diet and with your exercise. Avoidance of salt is the most important thing that you can do. The thing that I encourage patients to do is shop on the outside of the store. That is where you will find fresh fruits and vegetables, fresh meats that you can cook on your own. Dairy products and milk are all available on the outside of every grocery store that you ever go into. The problem that a lot of people tend to run into with their foods is that they're single. They think that eating a can of soup is good. It's very, very bad, because anything that comes in a tin can or a glass jar has had salt added to it. So I've seen people go into congestive heart failure from eating a jar of Vienna sausages. It can salt load you so severely that you will be in congestive heart failure. Frozen foods as well have a lot of sodium added to their bags or their boxes. Again, salt helps to preserve the food, and so it's added to it. Frozen foods are a little bit better than canned foods, but our preference is fresh because you can control the amount of salt that is going into your food. Other herbs and pepper, I don't care how much you use to get the extra flavor that you would normally get from salt. The other thing is that salt substitutes are very bad for anyone to use. They have a lot of potassium in them, and that will get patients into a lot of trouble when you have congestive heart failure. So don't use any salt substitutes either. Fresh vegetables, fresh fruits can be used with herbs and spices and all kinds of things to dress them up to make them taste better. You can make your own salad dressings at home, and again, much better control your salt. We will refer you as a practice to cardiac rehab. There, you will be on a monitor. They will monitor your oxygen levels. You will be on a bike. You will be on a walkway. Someone will watch you, and they will help you start an exercise program that is always better for your heart. Smoking is never acceptable in any way in healthcare. That is a very important thing for everyone to stop doing. It is not good for your lungs. It is not good for your heart. It constricts your blood vessels and makes heart failure worse. It will worsen your symptoms on a daily basis.